Today we shall talk about cervical cancer, the prevention and early detection. As you can see here, this is a schematic representation of the female reproductive system. This is the uterus. On either side we have the fallopian tubes and a pair of ovaries, one on the right and one on the left. The uterus, or sometimes we call it the womb, or in Bahasa we call it the rahim, consists of two parts: the body on the upper two-thirds and the cervix at the lower part. The cervix is sometimes known as the neck of the womb. In Bahasa we call it the pangkal rahim. Okay? Although the womb is one organ, it behaves like two. The upper two-thirds is called the body and the lower part is called the cervix. There are two types of cancers that can occur in the uterus. The upper part, the cancer can occur within the cavity, the inner lining of the womb, called the endometrial cancer. And the lower part, which we call the cervix or the pangkal rahim, we call the cervical cancer. So although the womb is one organ, the uterus is one organ, it behaves like two. The upper part, we can have the endometrial cancer, which is usually common after the age of menopause. The lower part, the cervix, this cancer can occur at any age, especially between the age of 35 to 45. Now, cancer of the cervix is the commonest form of cancer, especially in the developing countries. And globally, we see about 450 new cases every year. And unfortunately, there are about 300,000 premature deaths. I will call these unnecessary deaths because this cancer is preventable. Now, this statement came out in the Lancet way back in 1979, saying cancer of the cervix is death by incompetence because this cancer is preventable. So, incompetence on part of the patients for not coming for regular checkup, incompetence on part of the doctors for not encouraging and creating awareness, and also incompetence on part of the authorities, the regulators and so on to have a proper screening scheme for the population. Now, why we say cancer of the cervix is preventable? Because unlike most cancers, which is either cancer or non-cancerous, cervical cancer is unique in the sense we have normal and we have a definite pre-cancer stage called the CIN 1, 2 or 3, cervical intraepithelial neoplasia 1, 2 or 3, before it becomes cancer. In most cases, like for example, if you have a breast cancer, either it is cancerous or not cancerous. And if it's non-cancerous, it's good. If it's cancerous, we want to pick it up in the early stage, either stage 1 or 2. But in cervix, we have a definite pre-cancer stage. And this pre-cancer stage can be easily picked up with a simple procedure called the pap smear. This is a preventable disease. The cervix, as I said, is able to be screened by a process called pap smear, procedure called pap smear. The cervix is easily accessible through a speculum. It's got a definite pre-cancer stage, and the pre-cancer stage is treatable once you pick it up. And now we have also a vaccine which can prevent cervical cancer. Now, this is the lower part of the cervix. As I said, I mentioned earlier, it's the cervix, and this is how the cervix looks from below. Okay, this is the cervix, and the cervix itself consists of two parts. Outside we call it ectocervix, and the lips inside we call it endocervix. Okay, so the cancer can either occur outside or within the endocervix, the lips. So the cervix is easily accessible through a speculum. Okay, so we do a pap smear by using a speculum to expose the cervix, and then use one of these brushes to do the pap smear. As I said, the cancer can occur either from the outside or ectocervix, or inside we call the endocervix. So this is the brush. We just insert gently into the cervix and take a 360-degree turn and collect these cells. And we drop into this special liquid, and then once it's dropped, this specimen is sent to the lab where they harvest the cells, do special staining and look under the microscope and say whether the cells are normal or abnormal. Now, one thing to remember is in the pre-cancer stage, women will not have any symptoms. No such thing as bleeding, abnormal bleeding or discharge or anything. They are perfectly normal. And when we look at the cervix through the speculum, to the naked eyes, the cervix will look perfectly healthy. Only by doing a pap smear and sending to the lab and looking under the microscope, the cytologist will be able to say whether the pap smear is normal or abnormal. Okay? And important thing to remember again is when we do a pap smear, it's not to detect cancer, but to prevent cancer. Because once there's a lesion, a cancerous growth, we don't do a pap smear, we do a biopsy. So, important to know that pre-cancer stage, there are no symptoms at all, and even to the expert's eye, the cervix will look perfectly healthy, and the only way to pick up the abnormal cells is through this procedure called the pap smear. And what happens when you get an abnormal pap smear? Usually it's reported as either CIN 1, 2 or 3. We do a procedure called colposcopy. So what is colposcopy? Colposcopy is nothing but we magnify the appearance of the cervix by 10 to 15 times, and then we put a little bit of solution called acetic acid. This will remove all the mucus and also coagulate the protein on the cervix, and then we use the colposcope to look at abnormal blood cells, blood vessels like punctations, mosaic and all this. So this will tell us where to take the biopsy, and then once we get the biopsy confirming that it is a pre-cancer, we can easily treat it. So colposcopy again is just a magnification of the cervix 10 to 15 times, and with special staining we'll be able to look at the abnormal blood vessels, and then this will tell us where to take the biopsy and then predict whether it's pre-cancer 1, 2 or 3, which can be easily treatable. Now, once the report comes, this is an example of a colposcope where this is how the colposcopy will look through the cervix will look through the colposcope. And once the report comes, especially when it's CIN 2 and 3, we call it high risk lesions, CIN 2 and 3. CIN 1 we can observe, but 2 and 3 we need to treat. It can be simply easily treated either under local anesthesia or under general anesthesia by a procedure called LEEP, loop electro-excision procedure, whereby we just excise the abnormal area. It's something like a cone biopsy, but much shallower and much easier to do with less complications. So this LEEP procedure is a very standard procedure to treat abnormal pap smears, especially CIN 2 and 3. Now this procedure will take less than 10 minutes in the operation theatre or in the colposcopy room under local. So it can be done either locally or under anesthesia. It takes less than 10 minutes, and this procedure thus prevents the pre-cancer to become cancer. So that's why I'm emphasizing that this is a preventable cancer. Why preventable? Because there's a definite pre-cancer stage, and we can diagnose the pre-cancer stage by a simple pap smear. And once the pap smear is abnormal, we do a colposcopy, do the biopsy, and treat with this simple procedure. If for some reasons, if the pap smear is not done, or if the pre-cancer lesions are left alone, they may proceed to become invasive cancer, which is far more difficult to treat. Okay, so the emphasis is on detecting, ensuring that it is normal or in the pre-cancer stage, okay, which is treatable. Now, a question we always ask, how often should a woman do a pap smear? The first thing to remember is cervical cancer is almost unheard of or uncommon in women who had never had sexual relationship. In other words, it's not common in virgins. The reason why, we were wondering why this cervical cancer is more common in women who are sexually active, because lately, not so lately, about 50 years ago, we found out that there's a virus that's linked to this. And this virus is usually transmitted sexually. So women who never had sexual relationship, the risk for cervical cancer is almost zero, unlikely to develop. Once you are sexually active, someone is sexually active, we would suggest that you do a pap smear from the age of 20 to 65 once you are sexually active. Now, if you do a pap smear every year, through your lifespan, you'll be doing 45 pap smears. And the protection is about 97%. Nothing is 100%. Now, if you do 3 yearly, from the age of 20 to 65, you'll need to do 15 pap smears. And the protection is about 91%. If you do 5 yearly, you'll need 9 pap smears through your lifetime. And then the protection is about 83%. So on an individual basis, if somebody can afford to come to the hospital once a year, we will encourage them to come yearly. But in the national health screening program by the government, we will say at least once in 3 years, because the protection is still 91%, but you reduce the cost of pap smears by 1/3, especially for the government. So on a national screening program, usually we do every 3 years. Now, with the introduction of the vaccine called HPV vaccine, instead of doing 3 yearly, we can do 3 yearly. And it's also important to know that when a patient comes to do a pap smear, we just don't do a pap smear, we do a full history, we do an ultrasound to look for other conditions like fibroids or cysts or anything like that. And of course, when you do a speculum, you also detect for infections and other things. So when you come for a routine pap smear, apart from doing the pap smear, the women will have a general gynecological examination, which I think is good to come once a year. Okay? If we don't do the pap smear, and I want to again stress that unfortunately 90% of cervical cancers are detected in women who never had a single pap smear. They have not had a single pap smear. So especially in the poorer countries, the developing countries where there's no easy access to do pap smears, 90% of the patients who never had a single pap smear are the ones who go on to develop cervical cancer. In the early stages of cervical cancer, we got stage 1, 2, 3, 4. Depending on the location of the cancer. In stage 1, the cancer is only confined to the cervix. Stage 2 is spread to the sides or the vagina. Stage 3, right up to the pelvis or the lower third of the vagina. Stage 4, it is spread to the bladder, rectum, or even to the lungs and so on. So we got different staging of cancers. And in the early stage, there are sometimes no symptoms at all. In the later stages, patient may have bleeding in between periods, abnormal bleeding, or especially bleeding after sex. We call it postcoital bleeding. And sometimes we have abnormal foul-smelling discharge, which means the cancer is quite advanced. And of course, sometimes pelvic pain, urinary symptoms, bowel symptoms, and so on. Now, once the cancer is invasive, in the early stages, we can do surgery. And we call it a radical hysterectomy with pelvic node dissection. It's quite a big surgery. It takes about 3 to 4 hours. And it, of course, comes with morbidity, complications, and risks. So it's a very major operation. And unfortunately, in stage 3 and 4, we can't even operate on these patients. We have to send them for chemo radiation. So in the early stages, stage 1 and 2, we can operate. If the lymph nodes are negative, the surgery is enough. If the lymph nodes are positive in early stage, or in stage 3 and 4, we have to refer for chemoradiation. So that's a long process and expensive process, and this is an example of a cervical cancer where the uterus is removed. We call this a radical hysterectomy, quite a major operation. Now I want to talk a little bit on human papilloma virus, which I think the discovery of this virus and the link between this and cervical cancer, pre-cancer and cancer, has revolutionized the prevention of cervical cancer. So over the last 40 years, it has been recognized that this human papilloma virus has got a strong link with cervical cancer. So just like smoking, when you talk about smoking, not everyone who smokes will get lung cancer, but those who have lung cancer, there is a 95% chances he or she is a smoker. There's a strong link between smoking and lung cancer. The same thing with HPV and cervical cancer. Now, cervical cancer, we got nearly various types of HPV virus. 15 to 20 of these can cause cancer, subtypes of this. So the most common ones in Malaysia is type 16 and 18. The cancer causing virus is type 16 and 18. So what happens? Once a patient is infected with HPV, over a year or so, sometimes the HPV virus will disappear on its own. But if the HPV is persistent, in some cases, less than 10% of the cases, it may proceed to develop CIN1, not immediately, but over 2 to 5 years. And from there, it is the possibility to go to CIN2 and 3, which we call it high-grade lesions. And these are the ones we need to treat. And then if you leave them alone, it may proceed to invasive cancer. Okay? So there's a slow progression, not immediately, over a period of time, where persistent HPV can cause precancers, CIN1, 2, and 3. And if left alone, they may go to invasive cancer. So if any of these lesions with the pap smear and colposcopy in 1, 2, or 3, we can treat them within 10 minutes, preventing them from becoming invasive. Now this is important. So as you can see, over the years, we have found out that more than 300 million women are infected with this HPV virus, oncogenic HPV virus. If you look at statistics in US, over their lifetime, risk of getting infected with HPV is as 1 in 2, or 50% of the women will be infected with HPV, high risk. In Malaysia, we don't have much statistics, but one of the studies done in early 90s shows that at least 20% of our Malaysian women are already infected with HPV. And when we do a pap smear, we don't routinely check for HPV. But if you do it routinely, perhaps about 20% of women will have positive HPV. Now, we do HPV only when there is an abnormal pap smear routinely. So when we do a pap smear, we get an abnormal pap smear, we also proceed to do a HPV DNA testing. And this can be done from the same pap smear that we have done. The DNA from the pap smear could be extracted to check for the HPV presence. And as I said earlier, if it's CIN2 or 3 based on colposcope, we will treat them. Now, whenever we see a patient with HPV, it's important to tell the patient that that doesn't mean that she will go on to have precancer or cancer. Just like smoking. Not everybody who smokes will get lung cancer. So a vast majority of these patients, the HPV virus just remains as HPV without causing any changes to the cervix, or they may just disappear. Only about 10% will go on to develop low risk CIN, and then a smaller percentage, about 3%, will develop high grade precancer, and a very small percent, look at from 300 million, only 500,000 will go and develop cancer. So it's common nowadays for women to be told that you have HPV in your cervix, cervical smear, and that causes a lot of panic. So patients come to us and say, "Doc, I got HPV virus and I think I'm going to get cancer." No. It's good to find out that you got HPV virus. We do a pap smear regularly. Instead of yearly, we do 6 monthly, and to make sure that you don't go on to develop either the low grade or the high risk. So presence of HPV alone is not a big concern. It's because in US, about 50% of these women get infected. In Malaysia, about 20 to 30% of women may have HPV virus without any changes in the cervix. Now, this is the biggest development. If you ask me what was the biggest milestone in the prevention of cervical cancer, apart from the pap smear, is the introduction of the HPV vaccine. We have 2 different types in the market. Cervix, which contains about 4 different subtypes, and Gardasil, which contains about 9 different subtypes of the HPV vaccination. So, important again to know that these vaccines are taken over a period of 6 months, 3 doses at 0, 2 months, and 4 months later. So there are 3 doses of this vaccine. And even if you do the vaccine, it's not 100%. You still have to come for pap smears but you don't have to come every year. You may have to come at least once in 3 years, once you've taken the vaccine. And when is a good time to take the vaccine? Before you are exposed to sexual activity. So in the Malaysian government, we are encouraging our patients to have the vaccine taken in their teenagers, in the school days. Anytime after the age of 12 to 18, you can take the vaccine, and when you take the vaccine, it's important that you complete the 3 doses. And as I said, there are 2 different brands of this vaccine. So what are the milestones in the prevention of cervical cancer? As I said, this is a preventable cancer. Those days, we were focusing on downstaging. Instead of diagnosing the cases at stage 3 and 4, we say, let's diagnose the cervical cancer in stage 1 or 2, where we can operate on them. From then, the introduction of pap smears revolutionized the care of cervical cancer, because pap smears can pick up the pre-cancer stages. And with the introduction of the colposcope, we were able to manage CIN with very simple daycare procedures like LEAP procedure. As I said, we can easily cure or prevent the cancer from spreading. Then we found out the link between HPV and cervical cancer, and of course the availability of this vaccine is revolutionized. So in conclusion, what I like to say is cervical cancer is still a major problem. It's one of the major causes of unnecessary premature deaths, especially in the developing countries, and is easily preventable by a simple procedure called pap smear. Pap smear will pick up the patients in the pre-cancer stage, and we have a treatment which can almost 100% prevent the pre-cancer from spreading to cancer. So with the introduction of the HPV vaccine, the incidence of cancer of the cervix has dropped drastically. But unfortunately, again, just like the difficulties of doing pap smears in developed countries, the cost of the vaccine is still not affordable to many people in the poorer countries, and that's why a lot of effort from the part of the government and patients' awareness to introduce pap smears on a regular basis, and the vaccine, if possible, is the ideal way to prevent this cancer. This cancer is preventable, and there should not be any unnecessary premature deaths of this cancer. So with that, I'd like to conclude by encouraging our patients to go for regular pap smears, and if possible, encourage your children, especially the girls, to take the vaccine and during the teenage years, and this will dramatically decrease the incidence of cancer of the cervix, and again, that's how we will be able to prevent this disease. Thank you.